Top 15 dangerous diabetes nighttime signs you should know. Hello everyone and welcome to our video on a critical topic that could change how you view your health, the silent nighttime signs of diabetes. Sleep isn't just a time to rest, it's a window into your body's inner workings. When something's off, your body sends subtle signals, especially at night, that can reveal hidden health issues like diabetes. Did you know diabetes doesn't always announce itself with loud symptoms? It's like a quiet undercurrent flowing beneath the surface, with nighttime symptoms acting as the first ripples of warning. If ignored, these ripples can turn into a flood of complications. In this video, we'll uncover 15 dangerous nighttime signs of diabetes that everyone should know. From night sweats to restless legs, these symptoms are your body's way of sounding the alarm. Stick with us until the end to learn not only how to recognize these signs, but also practical steps to manage them and transform your diabetes care. Let's dive in. Why nighttime symptoms matter. Before we start, let's understand why nighttime symptoms are so important. When you sleep, your body should be in a state of balance, regulating blood sugar, repairing tissues, and recharging for the day. But diabetes, whether type 1 or type 2, disrupts this balance. High or low blood sugar levels, nerve damage, or other complications can manifest as unusual symptoms at night, disturbing your sleep and worsening your health. Poor sleep itself can make diabetes harder to manage, creating a vicious cycle. By recognizing these signs early, you can take control and prevent serious complications like heart disease, kidney damage, or nerve issues. So let's explore these 15 signs and what you can do about them. Sign 1: night sweats, a silent storm. Have you ever woken up in the middle of the night drenched in sweat, even though your room is cool? This isn't just a random occurrence, it could be a sign of diabetes. Night sweats often happen when blood sugar drops too low during sleep, a condition called hypoglycemia. When this occurs, your body releases adrenaline to raise blood sugar, which increases your heart rate and activates sweat glands, leaving you soaked. Alternatively, nerve damage from diabetes, known as diabetic neuropathy, can disrupt the nerves controlling sweat glands, causing them to malfunction. What to do? First, check your blood sugar before bed. Aim for a stable range of 90 to 130 mg/dL as recommended by the American Diabetes Association. If your levels are low, try a light snack with low glycemic foods like a slice of whole grain bread with peanut butter. Keep your bedroom cool, ideally between 64 and 70 degrees Celsius, 18 to 21 Celsius to reduce overheating. If night sweats persist, consult your doctor. They may suggest an HbA1c test to check your average blood sugar or assess nerve function for diabetic complications. Sign 2: leg cramps, a painful wake-up call. Picture this: you're fast asleep when a sharp, painful cramp in your leg jolts you awake. For people with diabetes, leg cramps are often more than just a random muscle spasm. They can stem from an electrolyte imbalance, low levels of potassium, magnesium, or calcium, which diabetes can disrupt. Another culprit is peripheral neuropathy, where damaged nerves in your legs send faulty signals, triggering muscle contractions. Poor blood circulation, common in diabetes, can also cause cramps by limiting oxygen to your muscles, especially at night when you're inactive. What to do? Boost your intake of electrolyte-rich foods. Try bananas or sweet potatoes for potassium and leafy greens, or nuts for magnesium. Before bed, do simple calf stretches. Stand a foot from a wall, place your hands on it, and lean forward to stretch your calves for 30 seconds. If cramps are frequent, monitor your blood sugar and see a doctor to check for neuropathy or circulation issues. Sign 3: restless leg syndrome, the uncontrollable urge. Restless leg syndrome, or RLS, is that maddening urge to move your legs, often accompanied by tingling or prickling sensations, especially at night. Studies show RLS is more common in people with diabetes due to peripheral neuropathy, which causes nerve misfiring in the legs. It can also be linked to dopamine imbalances in the brain, as diabetes affects metabolic processes that regulate this neurotransmitter. RLS disrupts sleep, leaving you exhausted and making blood sugar control harder. What to do? Incorporate light exercise like walking or leg stretches before bed to improve circulation and calm nerve tension. Boost iron and magnesium with foods like spinach, cashews, or oats, as deficiencies can worsen RLS. Avoid caffeine and nicotine in the evening, as they can amplify restlessness. If symptoms persist, talk to your doctor about possible nerve damage or dopamine-related issues. Sign 4: sleep apnea, a dangerous disruption. Sleep apnea isn't just snoring, it's a serious condition where your airway becomes blocked, cutting off oxygen to your lungs. For people with diabetes, sleep apnea is a double threat. It causes repeated awakenings, leading to blood sugar imbalances and increased insulin resistance, making diabetes harder to manage. It also strains your heart, raising the risk of high blood pressure, strokes, or heart attacks. What to do? Watch for signs like loud snoring, gasping, or choking during sleep. If you're overweight, losing even a small amount of weight can reduce airway pressure. Avoid alcohol or sedatives in the evening, as they relax airway muscles too much. If you suspect sleep apnea, see a doctor for a sleep study to confirm the diagnosis and explore treatments like a CPAP machine. Sign 5: frequent nighttime urination. If you're making multiple trips to the bathroom at night, it's not just an inconvenience, it could be nocturia, a common diabetes symptom. High blood sugar forces your kidneys to work overtime, filtering excess glucose into urine, which increases urination frequency. This can lead to dehydration, electrolyte imbalances, and sleep disruption. Nocturia may also signal kidney dysfunction, a serious diabetes complication. What to do? Drink most of your water during the day and limit fluids 2 to 3 hours before bed. Avoid caffeine and alcohol in the evening, as they act as diuretics. If nocturia continues, consult a doctor to check kidney or bladder function and adjust your diabetes management plan. Sign 6: excessive thirst, the unquenchable urge. Waking up with a parched throat, desperate for water, is a classic diabetes warning. High blood sugar causes frequent urination, which dehydrates your body, triggering intense thirst. If ignored, this cycle can strain your kidneys and lead to chronic dehydration or electrolyte imbalances. What to do? Spread your water intake evenly throughout the day to stay hydrated without overloading your system. If thirst persists alongside symptoms like dry mouth or fatigue, see a doctor to evaluate your blood sugar control and rule out type 2 diabetes onset. Sign 7: leg pain or numbness, the silent shock, tingling, burning, or numbness in your legs. Especially at night, could indicate peripheral neuropathy, where high blood sugar damages nerves. This not only disrupts sleep, but increases the risk of unnoticed injuries, infections, or even foot ulcers, which can lead to amputation in severe cases. What to do? Stay active with low-impact exercises like walking or yoga to boost circulation. Inspect your feet daily for cuts or blisters and wear comfortable, well-fitting shoes. If symptoms worsen, a doctor can assess nerve damage and recommend treatments to manage neuropathy. Sign 8: nighttime hypoglycemia, the hidden intruder. Low blood sugar at night or hypoglycemia can wake you with sweating, trembling, or panic. It's caused by excessive insulin or skipped meals, triggering adrenaline release to restore blood sugar. If untreated, it can lead to seizures or loss of consciousness. What to do? Check your blood sugar before bed. Aim for 90-130 mg DL. If it's low, have a snack with protein or complex carbs like cheese on whole grain bread. Consider a continuous glucose monitor, CGM, for real-time alerts. Always consult your doctor to adjust insulin or medication doses. Sign 9, insomnia, the sleepless struggle. Tossing and turning all night, blood sugar fluctuations can trigger stress hormones like cortisol or adrenaline, keeping you awake. Poor sleep worsens insulin resistance, creating a dangerous loop with diabetes. What to do? Stick to a consistent sleep schedule, going to bed and waking up at the same time daily. Have a small complex carb snack before bed like chia seed pudding. Avoid screens an hour before bed to reduce blue light exposure. If insomnia persists, ask your doctor about sleep studies or melatonin supplements. Sign 10, acid reflux. GERD, the nighttime burn. Acid reflux or GERD causes a burning sensation in your chest, often worse at night. In diabetes, autonomic neuropathy slows stomach emptying, increasing pressure on the esophageal sphincter and causing reflux. This disrupts sleep and affects blood sugar control. What to do? Avoid trigger foods like spicy dishes, chocolate, or caffeine, especially in the evening. Eat dinner 2 to 3 hours before bed and elevate your bed's head by 15 to 20 minutes. Sleeping on your left side can also help. If symptoms persist, ask your doctor about proton pump inhibitors or gastric function tests. Sign 11, nightmares or vivid dreams. The mind's horror show, vivid dreams or nightmares that jolt you awake, can be linked to blood sugar swings or sleep apnea. Low or high blood sugar overstimulates the brain, causing intense dreams, while sleep apnea reduces oxygen, triggering stress responses. What to do? Create a relaxing bedtime routine with meditation reading or calming music. Avoid caffeine or alcohol in the evening. If nightmares continue, consult a doctor to check for sleep disorders or adjust diabetes medications. Sign 12, high blood pressure at night, the silent thief. Normally, blood pressure dips at night, but in diabetes, it can stay elevated due to autonomic nerve damage or blood sugar fluctuations. This increases the risk of heart attack, stroke, or kidney failure. What to do? Monitor your blood pressure at night with an automatic device. Reduce salt and avoid processed foods at dinner. Steer clear of caffeine before bed. If readings are consistently high, see a doctor to evaluate cardiovascular health and diabetes control. Sign 13, palpitations, the heart's uneasy rhythm. A fast or irregular heartbeat at night, known as palpitations, can signal blood sugar imbalances or electrolyte deficiencies, e.g., low potassium or magnesium. It may also indicate cardiovascular issues common in diabetes. What to do? Ensure stable blood sugar before bed with a small snack if needed. Eat potassium and magnesium-rich foods like almonds or bananas. If palpitations persist, consult a doctor to check heart function and electrolyte levels. Sign 14, teeth grinding bruxism. The nightly grind. Grinding your teeth at night or bruxism can cause jaw pain or headaches. It's often triggered by stress from blood sugar swings or autonomic neuropathy, which tenses jaw muscles during sleep. What to do? Practice relaxation techniques like deep breathing or meditation before bed. Use a night guard to protect your teeth. Check your oral health regularly and consult a doctor if bruxism worsens to assess neuropathy or stress-related causes. Sign 15, morning headaches, the painful wake-up. Waking up with a headache can result from low blood sugar, sleep apnea, or dehydration from frequent urination. These reduce oxygen or energy to the brain, causing pain and fatigue. What to do? Keep your bedroom cool and quiet to minimize sleep apnea risks. Stay hydrated during the day, but limit evening fluids. Include potassium and magnesium-rich foods to balance electrolytes. If headaches persist, see a doctor to evaluate sleep disorders or blood sugar control. These 15 nighttime signs from night sweats to morning headaches are your body's way of warning you about diabetes or its complications. Ignoring them can lead to serious issues, but taking action now can make all the difference. Monitor your blood sugar regularly, adopt a healthy diet with electrolyte-rich foods, and incorporate light exercise and relaxation techniques into your routine. Most importantly, don't hesitate to consult a healthcare professional if any of these symptoms persist. They can run tests like HbA1c nerve function studies or sleep assessments to tailor a management plan for you. Thank you for watching this video all the way through. Your health is worth it. If you found this helpful, please give us a thumbs up, subscribe, and hit the bell icon for more health insights. Share this with someone who might benefit and let us know in the comments which symptoms surprised you the most or what tips you're going to try. Stay proactive, stay healthy, and we'll see you in the next video.